Welcome back, everybody, to another episode of Explain This. I'm with the star of the show, Robin Riddle. Robin, how are you today?
I'm good. How are you?
I'm wonderful, and this topic is interesting to me because we didn't explain this episode on the GI map, and this was mentioned. And we're going to go a little deeper today, and that topic is H-PYLORI.
H-PYLORI. Yep. I want to do a deep dive on this.
Let's do it.
It's been coming up a lot in my practice right now, and so I want to get some more information out about it. So H-PYLORI, it's Helicobacter pylori. It's a specific type of bacteria, and it's an infection that occurs when that bacteria gets into the stomach. It's very common to become infected with this as early as childhood, oftentimes through like familial contact, sharing drinks, things like that. This passes very easily. So over half the world's population is infected with H. pylori.
Wow.
Yeah. Lots of people have this. It's just if you become symptomatic or not. And there's a lot of factors that play a part into whether or not you become symptomatic. Gut health is huge. We always talk about gut health. I'm a strong proponent of keeping probiotics on board, keeping that good bacteria up so that bad bacteria like this cannot start to run rampant.
Interesting. Okay.
But extremely common. So symptoms of H. pylori, it can start out as things like just a little bit of an ache in the stomach, maybe some nausea. Stomach feels just kind of empty, kind of that gnawing, empty feeling. It can progress into things like reflux, heartburn, which can start to cause gastritis. You can start to have an aching, burning pain in the stomach that's worse when you're hungry. That's because H. pylori can start to actually develop peptic ulcers. You can develop ulcers from this.
Over a long period of time?
Over a long period of time, okay. Yeah. So usually we're not seeing ulcers until adulthood, but it can happen at any point. So initially you may be completely asymptomatic with H. pylori. Then you start with the little things. Like I said, the nausea, stomach feels a little off, maybe a little bit of reflux. And then it can start to progress and get much worse, and those ulcers can start to form.
Real quick, because it does seem like something that can be glossed over pretty easily.
Absolutely.
And what do you do for that? Like, it seems like just paying attention to these symptoms is the number one thing.
Yeah, and being a big proponent for yourself. It's very common for patients to end up with me for GI testing because they've kind of been through the ringer everywhere else and come to find out nobody's ever tested them for this, even though they do have symptoms of it. Some people, it's just frequent belching. You're just constantly feeling a little bit bloated, have some belching, maybe a little bit of reflux, and doctor just, here, take this PPI and you're going to be totally fine, when that's not what fixes it. Like I said, long-term, this definitely can cause some issues. So we can start to develop gastritis, which is inflammation of the stomach lining. We can start to develop peptic ulcers. Some strains have a high risk of stomach cancer, and H. pylori is one of the most common causes for any type of stomach cancers. So it's a big deal. It's a really big deal.
It sounds like a really big deal. And, one thing I'm asking myself is like, is this something that you have to live with your whole life, or can it be reversed, cured?
Yeah, absolutely. So first of all, it's testing to find out that you have it. So any sort of symptoms like this that are not being resolved or that you feel like are not being addressed, either you get something like the GI map done, which is where we talked about this first, and H. pylori is tested on the GI map with a PCR stool test. So something like that, but it also gives us big picture looks at everything else. If we're worried specifically about H. pylori and just want to look at that or rule that out, we can do a stool test that's specific for that. There is a blood test that can look for the antigens that are helping to fight the H. pylori. There's a breath test for it. And if you're getting an endoscopy with a GI doctor, they can actually do a little biopsy of the stomach to look for that bacteria as well.
Wow. Okay.
So number one thing is getting diagnosed with it. If you've had these symptoms and you've not been tested for it, you need to. Worst case scenario, you spend a little bit of money on a test to make sure you didn't have it.
Right.
But yes, we absolutely can get rid of it. This is where it gets tricky because you've got to stay up to date on the clinical guidelines for everything. Now, caveat, there are natural things that we can use for H. pylori, but it's not my preference, especially if we see what's called virulence factors. That shows up on our GI map test. If we see virulence factors, that tells us that it's a more serious infection and we really need to be more aggressive with getting rid of it.
Can you explain what that word means?
Virulence, it's just, it's something within the DNA of it. So basically, if I see a virulence factor come up, it just tells me that strain of H. pylori is more likely to cause some serious issues. So we want to get rid of it. So again, there is a natural way. There's a supplement called GastroMend that we can use, but your best way to treat H. pylori is to hit it hard and fast and get rid of it the first time. Once we've treated it and not gotten rid of it, it's going to be harder to get rid of going forward.
Okay.
It's very, very common to have recurrences of H. pylori if it's not treated appropriately. So traditional treatment for H. pylori, it's called a triple therapy, or the CAP protocol, which is clarithromycin, amoxicillin, and a PPI, most commonly omeprazole, or the LOAD protocol, which is levofloxacin, omeprazole, Alinea, and doxycycline.
Okay.
That's the traditional way to do it. But we are finding now that there is a very high rate of clarithromycin resistance, which is the most common antibiotic that most doctors treat H. pylori with. If we treat with that clarithromycin, we're not doing anything.
Interesting.
It's not going to be able to kill those bacteria off. So the ACG guidelines at this point are to not use clarithromycin on anyone who has ever in their entire life taken a macrolide antibiotic, like a Z-Pak. I don't know about you, but most people have taken a Z-Pak at some point in their life. Especially this area tends to have a really high clarithromycin resistance.
Interesting.
Yeah, so you've got to hit it the right way. The LOAD protocol is not using clarithromycin, but it is using that levofloxacin. There's a lot of risks associated with any of those levofloxacin or any of those associated medications, so still not my favorite. There's a new medication out now that I really prefer called Talicia, and it's a combination of amoxicillin, omeprazole, and rifabutin. Okay. So it's working differently. It has about a 90% cure rate with first treatment versus 65% cure rate with the other most common protocols that are used.
Okay.
So
wow.
We want to knock it out. We want to get rid of it. So when we treat H. pylori, we want to treat, so the Talicia that I like to use, it's for 2 weeks, and then we give a little bit of time, retest to make sure that H. pylori is gone. Now, the thing that you do have to also keep in mind is that there is high reinfection. So if your romantic partner has H. pylori, if someone else in the family has H. pylori and you share drinks, you run the risk of getting it back again. So I very commonly tell my patients, like, hey, you've got it. You should probably get your husband or your wife to get tested for it as well. You should be careful sharing drinks with other people, because we don't want to continue just to reinfect with this over and over again.
Yeah, that's what I was going to ask. Is it seems like because some of the population is asymptomatic, it seems like if you are symptomatic and have it, you're more likely to be symptomatic again if you get reinfected from someone who might not be symptomatic.
So that's why I just, have them go to their primary, have them come to us, something like that, and get tested to see if they are also carrying it. Because usually by the time people come to me and I'm diagnosing this, again, they've kind of been through the run with everybody else, and usually they're feeling pretty bad by the time they get here. So we want to get rid of it, and we don't want to have to deal with it again. We want it to be gone.
Should a patient like this be more vigilant around probiotics, prebiotics, enzymes?
Absolutely.
Okay.
Absolutely. Anytime I'm treating anything with the gut, my recommendation is always we need to stay on a probiotic. I love our Digest Shield because it's got the prebiotics and the probiotics in it. So it's got that combination that you need, but we need to be on something. We've got to rebuild that good gut integrity. We've got to get that microbiome back up to help prevent ever having issues again.
Super interesting. H. pylori, gut queen. I really appreciate you explaining that for us. Guys, this is something to look out for. Hopefully, you guys understand a little bit more about H. pylori right now than you did at the beginning of this video. I know I do. Robin, I appreciate this.
Absolutely.
Guys, y'all name it. We explain it. Apparently, I'm super Southern. As always, we'll see you guys next time.
Don't go away.